education. We are here to promote early diagnosis. We are here to improve public awareness or preventive skin health. We are here to address the psychological and social burden of skin disease. We are here to encourage evidence-based dermatological care. We are here to create a trusted public platform for dermatology education. Now, the Derma Dialogue serves as a bridge between dermatological science and the everyday skin concerns of the society. We are here to improve health literacy, reduce harmful practices, and promote evidence-based skin care. We welcome all of you to the Derma Dialogue on Z101.1. Enjoy.
Nansonya bema ne bema na bema ne osi bedwemu ese bema ni de na maye nwa muta me disa aka mu kwanka me wu ama ye meye pomo chichie friso mo be kasa de nche me wu a si de na sebe wo twan wo tifie ni ne be die chini na maye no level na bedu no banko me chiama ko ojana so atafo me de da me fo bezaya mabu umra me de da me fo bezaya mabu anybody to be shed esroma R.I.P. Daddy, watch me say, Mammy, Bohuna do to me. Open me say, Pusiaka. FNF so bad, Benny Betro, me can also no phone, yes, 70 to tra. A grown up me pro, yes, I must say, nah. She say, me no be any laughing emoji. Me famous here, your damage. I want a person walk out in our finish, actually, woo, she. Dipanya, she, when you see the theatre on the soap.
101.9 FM.
For today, it's Beyond the Pimples, also Z Multimedia, YouTube. Any question you want to ask about acne or pimple, we are here to respond. There are so many myths. We've received some questions already, and I'm going to read some. So, what is the most surprising thing you've heard people say causes acne? The second question we received, very interesting. Growing up, what did people in your house say causes acne? We had some examples. So, granuts, oily food, or even something else.
I'm glad that I'm calming down. Can't let no
Now, have you ever tried squeezing a pimple and later regretted it?
fighting but falling slowly. If ever you are in doubt,
Or have you ever used a cream that cleared your acne quickly, but later acne? We are here to talk about pimples.
call it love. She fights it but falling slowly.
Every single day we receive complaints from people. Receive complaints about pimples, receive complications of pimples.
Your skin just like pearls. Your back
We also receive very life-threatening complications such as acne scars.
your skin just like pearls.
There are some psychological impacts of acne, especially on adolescents, on young adults.
Like a trophy when Naomi's walking. She need an Oscar.
Now we are here to talk about acne.
Drip broke the levee when my Kelly's rolling.
In the next few minutes, we are going to talk about the causes of acne. We also talk about how acne also presents. Then, interestingly, treatment of acne.
Can't let no one come control me. Keep dancing and call it love.
Again, all your questions are welcome. 0544321019. Acne we define as a chronic inflammatory condition. And before you understand or before you appreciate acne, we need to understand how it comes about. We need to understand what we call the pilosebaceous unit. We need to understand why others are prone to acne or why people's acne refuses to go. Now, the number one cause of acne, the first most important thing we need to talk about, is the fact that acne tend to be common in certain people, certain skin types than others. We are talking about the oily skin. We are talking about products that people use. We are discussing certain medication that people take. And again, our products, our cosmetics, our lifestyle, and all these leads to acne. A very interesting thing that we need to differentiate. I get this a lot. Doc, is acne the same as pimples? People ask me or people confuse whether acne is the same as pimples. People refer to acne as when it gets that worse, very severe form of pimple. And people also call the very mild form of acne as pimple. So pimple is just a single lesion of it. So acne is the name of the disease or the condition, whereas pimple is just, how it presents. So sometimes you can have a solid rash. So you can have just a rash on your face. And there are times when you can have a rash that has something in there, what we call pustule. So sometimes people refer or people call whiteheads. People say, whiteheads. Others call it dark heads. So that's the open comedones and the closed comedones. So the open ones, we say dark heads. The closed ones, we say white heads. So these are things that we need to differentiate. So acne is the name of the condition or the disease, whereas the pimple is just how we describe one of the presentation. So one pustule or one papule is called pimple, but the condition itself is called acne. Now, we need to understand how it comes about. There are four main things we need to talk about. And at this point, we are still inviting questions. Now, the first most important thing is what we call the follicle. Every skin has these holes, or it has these pores, as we call them. Now, there are times when the pores get clogged or blocked. And once that happens, then there's a trigger or there's a cascade of events that leads to the formation of pimple. And that's what we are talking about. So there is something called keratinocytes. That's a cell. And once there's a clogged pore, it leads to these, multiplying. And once it starts multiplying, the multiplication is very abnormal. So picture a hole that has certain cell in there that keeps on multiplying, and unfortunately it is blocked. So whatever is being produced is not able to come out. So that's the first thing that happens. Secondly, there's what we call sebum or oil production. And that is what is being produced by what we call sebaceous glands. We all have sebaceous glands. So some people produce more oil. And once the pore is clogged, you keep on producing the oil. And once you're producing the oil is being converted to what we call fatty acid by a bacterium. That is the reason why when you are treating acne, you need an antibiotic, because there is a bacteria that causes or that helps with acne formation. And it has a very interesting name, Cutibacterium. So Cutibacterium is a bacteria that feeds or that converts these oils to fatty acid. And that's the reason why anytime we squeeze the acne or the pimple, we see this yellowish thing that comes out. And once this is happening, then there is an inflammation that comes with it. So inflammation is your body responding to the injury. And that is what causes all the pain and the reddening that comes or that is associated with acne. So we have described what leads to acne formation. Now, the presentation is different. Some people, they have very huge ones that comes on their face. Others too, they have very mild ones that appear. Then sometimes some people will tell you, Doc, my own is within the skin. So anytime I'm having my menses, the pain is severe or the pain gets worse. And interestingly, others will tell you, Doc, in addition to my acne, my menses are not flowing well. So you can have like a whole month, sometimes 2 months or 3 months without having your menses. And the question is it linked to the acne or pimple? Yes, because there are certain conditions that has acne as part of them. The commonest is what we call PCOS, that's polycystic ovarian syndrome. And that is the relationship between the dermatologist and the gynecologist. So acne, yes. Importantly, we need to find what causes the acne. Once you know exactly what causes the acne, then you treat it. Because there are so many reasons or there are so many complaints of acne, especially when they start treatment. They tell you, Doc, it got better, but I'm saying it's gotten worse. And the reason is very simple. If you don't treat or if you don't isolate the triggers, you will still have your acne appearing. Another question that we do get a lot, in fact, acne is part of the common 5 conditions that we encounter in the consulting room. And because of that, it also comes with complications as well. So, we need to zoom into the lifestyle, the creams that we use. There are certain creams that when you use, what happens is they are capable of blocking the pores. And once the pores are blocked or clogged, all these events kicks in. So sometimes you may not be doing anything wrong except using the bad cream or the wrong cream. Anytime or people who have oily face, you are supposed to move away from using greasy creams. So sometimes we call them comedogenic. But all that it means is any cream that is capable of clogging or blocking your pores, you need to move away from it. And no matter how effective the treatment is, as long as you are using or you are still in contact with this cream, it comes back. And that's very important. So we are here to also educate people on the right products to use. There are some products that when you use, what they do is in addition to clogging the pores, especially when we are treating the hyperpigmentation or the dark spots that comes with acne. So people spend money buying products all in an attempt to treat all these hyperpigmentations. And what they do is it lightens your face making the dark spots more obvious. And that's something we need to talk about. So one most important thing we need to move away from is the steroids. So steroids are examples of steroids are the triple action creams, the Sulfax, the Fambact A. Yes, when you use them, it calms it down. The moment you apply it, at least 72 hours, it calms it down. However, it is not actively, treating, or it's not a long-term acne treatment. So people are hooked on these triple action creams. So we are here to talk about the effect of these triple action creams. So triple action creams, they do not cure acne. They just control the inflammation, the reddening that comes with it. And we are not allowed, or we cannot use triple action creams for a long period of time. So that is the reason why anytime we use triple action cream for a long time, you notice your face is getting lighter. You notice the dark spots is getting more darker or obvious. And also the acne, the moment you stop using the triple action cream, the acne comes back. So that's the main reason why we need to avoid these triple action creams. Now, we need to talk about the psychological impact of these acne. There is what we call treatment inertia. Sometimes people seek treatment, they don't seek it early. So they use all these over-the-counter creams, and by the time we see them in the consulting room, they have all these complications arising. And sometimes it's not pleasant at all. We have what we call acne keloid, especially around the cheek area. So you have somebody who tells you, Doc, yes, I have acne, but when you examine, you notice this one is a bit harder or firmer than the others. And once you start getting acne keloids, we need to, and it doesn't only appear on the face. So once we start getting acne keloid, we need to have a long-term treatment of the acne. Again, if you don't start early treatments aggressively, what happens is complications such as acne scars, and it's one of the difficult things to treat. So the scars, yes, it can be pitted, more like it goes inside or deep within your skin, or it can be hypertrophic. That is what we call the acne keloid. So these are complications of the acne that we need to talk about. Now, anyone who has encountered especially triple action creams, you can share your experience with us. Triple action creams, when applied, it calms it down, but just for a short period of time. Acne do not only appear on our faces. So pimples also appear or can happen on our neck, our chest, upper part of our body basically, our arms, our back. And most of the time, the creams we use are very important. Some of these creams, they are able to clog or block the pores. And once the pores are blocked, it leads to all these acne that we are talking about. So, acne doesn't only appear on our faces, it also appears on our body, our chest, our back. Now, there are certain conditions that present just like acne, but they are not. And we need to differentiate between them. That is the reason why anybody, if you know anyone who has had acne for a long period of time, been using the same treatment as if it's getting better, few minutes or weeks later, it gets worse, we need to investigate. We need to find reasons why that is happening. The self-medication, yes, but we need a long-term solution so that we can avoid some of these complications. Now, somewhere last year, we did a research. We did a research on the psychological impact of acne on adolescents and young adults. And it was mind-blowing. We tend to be only interested in clearing the acne or clearing the face, but trust me, lots of people have, especially the psychological part. So, anyone who sees or who treats, there's what we call the treatment inertia. There's always the time to use a higher treatment. You should always aim at the long-term treatment of the acne. And that is something that we are not doing. So we are breaking it down. Acne or pimple, we say there are causes. You should always find the causes. Once you know the causes, you take your time and you isolate the cause and you treat fully. If there is a need to hit hard, anybody who has had acne for a long time or anyone who has been using these over-the-counter creams, please, the earlier you seek treatment, the better, so that we don't get all these complications setting in. Now, there are different types of treatment. We are going to zoom into what we call the acne tips or the skin tips on acne. The first most important tip that we want to share is, if you have an oily face, we advise that, especially people with oily face, however, dry legs or the other part of their body feels dry, we advise, do not use these thick creams that you usually will apply on the other part of your body. We do not apply on our faces. And that's very important. So the first most important tip is, we are not applying these thick creams on our faces, especially when we have acne or when we have oily faces. That's the first one. Now, the second most important tip is, triple action creams, they are not a long-term acne treatment. So acne treatment is not about quick fixes. It is about the correct diagnosis. You need to know exactly what we are dealing with. Now, when acne is treated early, scars and all these emotional damage, they can easily be prevented. The third most important tip is, people tend to use harsh products on their faces. So when you have acne, there is always a myth of using harsh products. Some people use Dettol or use all these antiseptic directly on their faces. Some use sugar solutions. Others even use, egg. So what we will say is, all these harsh products, when you use on your skin, what you are doing is, rather, you are destroying or you are breaking your skin barrier. Once your skin barrier is damaged, then we have a new problem to also fix. So importantly, we need to know exactly what is causing or what the trigger of the acne. Then we hit hard with the treatment. And once you're on the right path, especially when it comes to these, causes of it, if the person has, some people call it hormonal acne or hormone-induced acne. So classically, you have acne that comes very painful once it gets worse during your menses, and typically comes just on your cheeks. So it is very common on your cheeks and your chin area. And once you start getting these, there may be the need to investigate. And that's the reason why in certain instances, there is a need to run some tests on, the patient. So this is very important. We are discussing acne. If you just joined us, we are discussing acne. We have touched about the causes of acne. We spoke a little bit about the how it presents as well. And we have shared some tips on acne. So if you want to join us with on this conversation, the number again, 0544 321 019. You can send us a WhatsApp. You can also call us. We'll go on a quick break. We'll be right back.
I think tonight she might break her braids. Melanin too dark to go hush.
Z101.9, and we are talking about acne. We are here with invited questions. The lines are 0544 321 019. So 0544 321 019. We are still discussing acne or pimples. We are here to debunk all the myths. We are here to provide real solutions, to give skin tips as well. Before we went on break, we've been talking about the causes of acne. We've also touched on the skin tips on how to prevent acne. And we keep on hammering, or we keep on saying the most important part is knowing the cause of it. Once you know the cause of it, you isolate the cause and you treat fully. And basically that's what we've been up to. Now, let's talk about what we call mimics of acne. So basically, what we are interested in now is there are certain conditions that present just like acne or that present like pimples. And we need to talk about them. A very common presentation is what we call the periorbital dermatitis. So some people, I don't know if you've experienced this before. You have these rashes that appear or that present like acne or pimples, but it's just around your mouth. So just around your mouth, you see lots of these, sometimes they are papules, sometimes they are a bit, it feels like there's pustule or there's fluid in there, and they just appear around your mouth. Rarely would they, extend to your cheeks area. Rarely would they go to your forehead, but mostly just around your mouth area. So when you see this is what we call the periorbital, dermatitis, and this is not acne. People confuse, periorbital dermatitis with acne. And that's the reason. So this is as a result of abuse of steroids. So if you use the triple action cream for a long time, sometimes that's what happens. You notice you have these rashes that appear around your mouth. And again, some people still continue using the triple action cream. So it goes and comes. And you can have this condition for a long period of time. So definitely periorbital dermatitis or periorbital, it's a very common, or it's a differential for acne that we need to talk about. Secondly, there is a condition where, you have these bumps that appear around your eye area. So that's what we call syringoma. So syringoma, you have these, it's usually, you don't have the classic, comedons in there. Or when you press, in other words, when you press, nothing comes out. And you see people treating that as acne. There's another condition, what we call seborrheic eczema or seborrheic dermatitis. So classically, around your cheek area, you see this tiny rash that comes there. And most of the time, it is associated, or it's also, it comes with dandruff. And people, again, treat this as acne. So these are the reasons why anytime you see anything that looks like acne, especially when you've been treated, you've used several creams, you've used triple action creams, you've used your tretinoin, your adapalene, it's still not getting better, there is always the need to come and see us. And the earlier we do, the better, so that we can prevent all these complications of acne. Now, let's talk about treatment. Treatment of acne, one, depends on the type of acne you are treating with. You are dealing with. So we have different types of acne. If you are treating acne cosmetica or acne as a result of a cream that the person is using, the most important thing to do is to isolate the cream, or is to stop the cream. If you are still using the cream, what will happen is, yes, the acne gets better, but only for a short period of time, and you notice it starts getting worse. So that's the reason why there's a need to always isolate. So I keep on saying, if you don't know what is causing the acne, then there's no point you even initiating treatment. Because what's going to happen is, yes, the acne will get better some way, somehow, but unfortunately, it starts getting worse. You can share with us anyone who has had very terrible acne, has used all sort of creams, especially when it gets better, but only for a short period of time, and it comes back. We want you to share your experiences. Share your experience with us. So the first rule when it comes to treating acne or pimple, importantly, is knowing the cause of it. Once you know the cause of the acne, then you move away from it. So the classic one, I had a patient who presented who had a history of, abnormal menses. So sometimes the whole 3 months or sometimes even 4 months, she's not getting her period. Now she comes, in addition, she noticed she's getting what we call, so you can have a female, no history of, so some certain families, they have hair, as we call them. But you notice all of a sudden, female has started growing hair. And once this starts, there is a second, so you need to delve deep into it. In such an instance, if you just prescribe all these, treatment, yes, it might get better, but because the problem, as people will say, is in your blood. So what usually happens is, it gets better for only a short period of time, and it starts getting worse. So in such an instant, that's the reason why we'll tell you to go and do a scan, a pelvic ultrasound scan. Because then we want to be sure, we want to check whether there is polycystic ovarian syndrome there, or there's some polycystic ovaries, or not. So this is very important. We do this. This is very important. We differentiate, or we find the actual cause of it. And once you know the actual cause, then we take it from there. So we have a question here. We have, so I'll read a question. So Z with another step ahead of others. Thank you so much. This is Yao, a J from Equiapim Ekropon. So Yao wants to know, so a whole show dedicated to skin, Z, no size. By the way, Doc, how do I know what cream is suitable for my skin? I never knew the cream or oil or pomade I use has the potential to cause acne on my skin. Go Z, go Ghana. So thank you so much, Yao. Yao, that is why we are here. So sometimes, just by knowing your skin type and the creams to use alone is more than enough. So Yao is asking the cream that he can use for his skin. So Yao, the first most important thing is we are going to walk through this together. We need to do what we call the bare face test. So bare face test. What it means is, you can take a shower, you wait for an hour. So after your shower, you don't apply any cream. So no cream, no cleanser, nothing. And we are talking about the face here. So wait for 1 hour. Now, after an hour, these are the things you are looking out for. Some people, after an hour, you realize the whole face is oily. They've not applied any cream. They've not used any cleanser. But you have the whole face oily. Now, once this happens, we say you have an oily face. And you see, sometimes you can have an oily face. However, the other part of your body, so your legs, the extremities are dry. So, and what we mentioned earlier on, that is what we call sebaceous glands. So what it means is, some people, they have lots of, or they produce more sebaceous or sebum. So once you have lots of sebum, or once you are producing, more, then definitely you stand a chance of it getting clogged or blocked. And that's something we need to also appreciate here. So after an hour, some people, what you realize is, you notice their face is still dry. Sometimes it gets flaky. Oh, I say ope foul. So it gets dry, it gets whitish, and it involves the whole face. So once it happens like this, we say you have a dry face. So dry face, initial one was oily face, and there are times when it applies and you after 1 hour you notice it's not the whole face. So there's what we call the T-zone. So a classic one is the forehead area all the way down to your tip of your nose to your chin area. Those areas get oily, but the other part, so let's say your cheek area, those areas are dry or normal. So such a person, we say you have combi or combination skin. Then there are others before weather, so just after shower and after an hour, you notice there's no difference. So those people, we say they have a normal skin in quotes. The normal because there's no change in their skin. Then we have others, we say you have a sensitive skin. Sensitive skin is very simple. So some people, when they apply certain creams or certain products, they tell you, doc, it's burning my face, it's making my face. Sometimes the classic one is they tell you it feels tensed, you know. So if you know your skin type, then you know which products to buy. So for instance, if Yao has an oily face, if you go to town, especially with a product, any product you are buying for your face, you need to check out for these ones. You check if they've written, greasy, or if they've written oil-based, or sometimes they do water-resistant. So such products, what it means is, if you apply on your face, somebody who has an oily face, if you use such products, there is always a potential of it clogging the pores, which will lead to some of these rash that we experience. But if Yao has a dry face, then you can go in for ceramide-based product, and you don't have any problem with it at all. So we need to know your skin type by doing the bare, face test. Once you know your skin type, once you go to the market, then you can know exactly which products to buy. They will not write comedogenic product or comedogenic, prescription or description on the product. However, you will get oil-based, water-based, and sometimes greasy, non-greasy there. So very important. Now, we have another question here. It says, how can I prevent acne from getting worse? So first of all, in an attempt to prevent or treat acne, sometimes we make it worse, especially when we start using these triple action creams. So the Fambact A, the Sulfax, the Dermiron, all of them. And the more you use, yes, it's going to calm it down, but the moment you stop, you notice it starts getting worse. So the first most important thing is, we say, man, know thyself. So know your skin type. Once you know your skin type, then you know products to use, because from today, we are aware that certain products, they are capable of clogging our pores, which will lead to acne formation. So that's the first most important thing. 2, anything that makes it worse. So somebody would tell you, doc, what about food? I realize anytime I chew nut. So the truth is it doesn't apply for all of us. Some people, diet alone is not strong enough for you to be getting pimples, or especially the terrible ones. No. However, it may coexist with other risk factors. So somebody who has an oily face and who likes taking, so we say, high glycemic index foods, these sugary or these refined, sugars. And what you are doing is, there's a hormone called insulin-like growth factor. And the whole idea is, it leads to the production of a hormone called androgens. And the androgens are what makes us produce more sebum, more oil. And that is where the problem is. So someone wants to know, what are the best treatments for different types of acne? So first of all, as I said, you need to know diagnose the acne. Once the acne is diagnosed, so for instance, if the acne is as a result of using certain product or using comedogenic product, so what we do is you need to move away from it. Once you move away from it, then we can treat it. So with the treatment, first of all, we have mild, we have moderate, we have very severe acne. So if it's severe, then definitely we need to hit hard. Hitting hard means you need to do not just a short-term treatment, a long-term treatment. So there are times when you need to come to us, we run some tests, because we want to avoid complications of the acne. Complications such as the acne scars, complications especially with the PIH, the post-inflammatory hyperpigmentation, the dark spots. So these are complications that we need to, avoid. So if it's a severe form, definitely we need to come in. Now the mild form, sometimes you don't need to do much. I've had instances where patients will tell me, Doc, I kept on using so many things, it wasn't helping. So all that I did was I stopped using everything and I was just using my moisturizer. And I realized it was clearing. So sometimes you don't need much. All you need to do is to stop using what is causing, or isolate or move away from what causes the acne. That one alone is enough. However, if we are dealing with a typical acne, maybe mild to moderate, then sometimes there's a need to see us. We prescribe these retinoids. Now, we need to differentiate this. The retinols that you have in these cosmetic products, it is not the same strength that you get, especially when used or when you come or you buy from the pharmacy shops. I get this a lot. You can get a patient with a very severe acne and tells you, Doc, I've been using retinols or retinol containing, but there is no improvement. And I tell them, it's because the retinol you are using, the strength is not a therapeutic strength. So most of the time, it's more like, like a routine, that we cannot use such for active, acne or these severe acne. So that's very important. Then someone wants to know, are there foods or habits that make acne better or worse? Yes, and that's why we are here. So we'll start with maybe the worst. The first most important thing is, I keep on repeating, is the products we use. So yes, I know you want to glow. I know you want to tone. However, there are certain products that the fact that a friend of yours, a relative, used the same product, yes, and they are enjoying their skin, it doesn't mean it's also going to do well for you. As we say, man, know thyself. If you have an oily skin, you are not supposed to use oil-based creams on your face. Vaseline, yes, petroleum jelly is very good. However, if you have an oily face, we do not apply Vaseline on your face, because what you are doing is, it is thick, and because it's thick, it's going to clog the pores, and once the pores are clogged, eventually it leads to acne formation. So these are the things that we need to avoid. The second one, the triple action creams. We can't say much, because anytime you use a triple action cream for a long time, not only is it getting, or are you putting the person, or are you putting yourself at risk of all these, rebound acnes and stuff, you are also reducing, the protection. So once this is happening, then unfortunately we are no more. We cannot really, hit hard with the acne because it's destroying your skin barrier. And so all these are things that we shouldn't do. What we should do are the opposite of the things that I've mentioned. Then we spoke about the causes earlier. Someone wants to know, please, I have had, I think it's atopic, the person meant. Atopic eczema my entire life, and it's really bad, and how do I go about it? So atopic eczema, definitely, that is why Z Multimedia has brought this program for you. So Derma Dialogue, definitely we're going to have a session on atopic eczema very soon. So please stay tuned. Doctor, you are the best. Doctor for me is okay. She's asking about whether butter, chocolate, nuts. Okay, so what can I do? So she's saying anytime she takes butter, chocolate, and nuts, she keeps getting acne. And I keep on saying this. So the most important thing is to move away from them. So once you know your triggers, you move away from your triggers. And sometimes, yes, they may be causing, but in addition to this, you realize the cream you are using. So all these things, acne treatment is just a multiple of. So it's not just, you need to move away from, you can have more than one risk factors. You can have more than one causes of it. So most importantly, know your skin type, choose the right product, and we are here to guide you. And thirdly, triple action creams, jack of all trades, please move away from them because it makes the treatment very difficult. So this is the maiden edition of the Derma Dialogue on ZFM 101.9. We spoke about acne. We spoke about pimples. We've been able to also break some myth surrounding acne. We've answered certain questions. But if you have more questions, you can go on Z. So you can check ZFMGH on Instagram, on Facebook. You can also reach out on the Z Multimedia, YouTube as well. And if you have a relative, if you have anyone who has a very difficult acne, very stubborn acne, you've used all these medications, it's not helping, you now have complications, I'm going to put a number here. You can call, we will take our time, and we are going to make sure we solve this once and for all. So 0256 06 3807. So anyone who you've had very terrible, acne in the past, you've used all things as you usually say, please call this number 0246 06 3807 and let's book for a consult. Thanks for joining us. We've been it's been a very revealing, and thanks for also your questions. All we need to do when it comes to acne treatment is to avoid our triggers. Once you avoid your trigger, then the treatment, it goes and it doesn't come back. So I've been your host, Dr. Kofi Ansah-Brefo. I'm the founder, Skin Foundation Africa, and also the West Africa representative of the International Society of Dermatology. And this has been the maiden edition of the Derma Dialogue on ZFM 101.9. We look forward to next week. We look forward to every Saturday, 6:30 p.m. And we are here to talk about the skin. Get your skin questions ready. You can even send them on all our social media handles. Send them to us, and we'll definitely talk about it. So have a great evening, and thanks for listening.